final time here. Several months ago, I got a call from one of my friends and patients, Dr. Bob Carton, who spoke to this academy a few years ago in Pittsburgh. And Bob always lets me know when new things are happening on the fluoride front if I haven't heard about them already. And he let me know about a study that had been published about a year ago, and gave me the phone number for the person who published that study, which is our next speaker, Dr. Phyllis Mullinex. I picked up the phone and called Dr. Mullinex, and we had a very, very fascinating conversation. And I invited her on the spot to come speak to this group because she has some research, but also a story behind the research that I just thought was fascinating. And I know you will too. Just to give you a little bit of her background, she has quite an extensive curriculum vitae. But she received her PhD in pharmacology from the University of Kansas Medical Center, did her postdoctoral training in environmental medicine at Johns Hopkins. She served for 12 years as the head of the toxicology department at the Forsyth Research Center up in Massachusetts. Currently is on the staff at both Harvard and Forsyth, and also is doing a research associate in psychiatry at Children's Hospital in Boston. She has literally dozens and dozens of articles, books, book chapters, and so forth that she has published in the peer-reviewed literature. The one that caught Bob's and my attention, and will catch a lot more of attention, is a study that was published in neurotoxicology and teratology on the neurotoxicity of sodium fluoride in rats. Dave Kennedy alluded to that study a little bit yesterday in his presentation. But anyway, it's a great honor and a privilege to introduce Dr. Phyllis Mullinex. Please give a warm Academy welcome.
Thank you very much for the introduction. And I must say, it's a pleasure to be here because I'm very hopeful for once to speak in front of a dental community that doesn't want to tar and feather me. I'm about to tread upon the toes of the protected pollutant, I would call it, called fluoride. The name of this talk, I had first said fluoride affects brain function. But in reality, what I should have titled this talk is Mr. Toad's Wild Ride. Because this entire story has been nothing but one wild ride. I'll have to say that I probably didn't hear the word fluoride before 1982. I could have cared less about fluoride before that time. And so I have no political agenda about it. I'm not from a long line of fluoride fighters. I really had no feelings about it one way or the other. If we could start with the first slide, because my talk is designed.
On the front. Top edge.
Top edge on the front. Okay. I hope you can see this because I want to answer the age-old question, what's a nice girl like me doing with fluoride? Well, it started out in 1982, and I was minding my own business. What was my business? Actually, I was known for several years, since actually it's been about 25 years, for working on procedures to screen for neurotoxicity. I had been involved in methodology or development of methodology that would do this very difficult task. And so I had gone through several types of methodologies and procedures to do this type of testing in the laboratory, especially designing animal models to look at this issue. Then in 1982, Jack Hine at the Forsyth Dental Center became aware of me and my work. I was over at Children's Hospital at the time. I was in the Department of Neuropathology and the Department of Psychiatry, working on animal models, developing a methodology to do the types of screening. Dr. Hine invited me to come over to the Forsyth Dental Center and to take a look. And in this picture that you see here, you'll see Jack Hine on the right. I know there's a laser here somewhere. Jack Hine. And on the left is Dr. Harold C. Hodge. And when we started this department in 1983, I was made head of that department. Dr. Harold C. Hodge was also put into that department at the same time. And I was very proud of the fact that Dr. Hodge was put in my department because Dr. Hodge had been a professor of pharmacology and toxicology at the University of Rochester for a number of years, been at the University of California. And also, I was also very proud of the fact that Dr. Hodge was the chief pharmacologist of the Manhattan Project. In case you hadn't heard of the Manhattan Project, or maybe you're too young to have heard of that, but it was the project involved in designing the atomic bomb. So I was very happy to have Dr. Hodge in that department, and we talked for a number of years. When along with this picture, it says here, and Dr. Hine wrote a letter that came out in the Forsyth Dental News in about 1984. And here's what Dr. Hine said in this article. I quote, "Societal concerns are becoming justifiably aroused over the long-term implications of traces of toxins in the environment. As a major center of dental sciences, we at Forsyth believe our institution has a special obligation to answer these concerns by a re-examination and reassessment of the long-range toxicity of substances of particular interest to dentistry, as, for example, the fluoride ion, mercury in dental fillings, nitrous oxide for anesthesia, non-precious metal substitutes for gold, and many others. But beyond our interest in the toxicity of specific materials used in dentistry, it is our desire to advance methodology for detecting toxicity. Dr. Mullinex has evolved a new technique which indicates a much more sensitive test than the traditional means of the testing of compounds causing toxic effects on the nervous system." So with that introduction, I got into and we started developing the toxicity, we started the toxicity department. And I came over to Forsyth. I was interested in Forsyth because they were going to allow me to work on a new methodology that I really wanted to work on. A lot of the hindrances to working on neurotoxicity screening was the problem of doing things by hand. I did a lot of studies by using time-lapse photography. It was very slow. You couldn't get enough numbers for statistics. It was absolutely impossible. And I had been talking for years with a person, a physicist, actually. Now, this physicist didn't fall off the turnip truck. This physicist, I had known before I ever went to Forsyth that I was going to be working on this problem, and what we wanted to do was to computerize the entire process that we were doing. We were setting up to do neurotoxicity screening so that industries could handle this. They could test one substance after another, and we could go very rapidly. This physicist happens to be from Iowa State. This physicist also was worked with the Department of Energy. He was the director and head of the Ames Laboratory in Ames, Iowa. He was taught for many years in the physics department there, but also he was in the veterinary diagnostic clinic. And in the shadier side or quieter side of his life, what he did was he also, in the Department of Energy, he had a Q clearance, of course, and would work on projects that weren't exactly public. But what he was really doing was following the movement of hydrogen particles through three-dimensional space. Wrote computer programs and things to follow things in this three-dimensional space. He said at one time, as he was growing on in years, he said, if I can follow hydrogen particles through three-dimensional space, I can follow animals in three-dimensional space. We can do the computer programs that you want to do, Phyllis, for the rat. We did it for the monkey, you can do it for the rat, and so we can take out all human intervention, all the subjectivity there is involved in neurotoxicity screening, and we can computerize the entire thing. So he had the programs in place from his programs where they also applied them to follow the movements of troop trains from up in satellite positions. Again, it was monitoring movements from very long distances away. So he's a very interesting character, and he had a grant from the Environmental Protection Agency to develop this technology, and they developed it for monkeys. So to move on quite quickly, we converted what he had done for monkeys, we converted it to rats. We had a setup where we could take a control and an exposed animal side by side. We had cameras coming in from the front, cameras coming in from the top. You probably can't see those here. But anyway, what was unique about this is that we would measure a control and exposed animal at the same time. Now, from those, in that environment, cameras were in and they were fed into a computer room. And at the Forsyth Dental Center, the top floor of that building, which was built to house this computer pattern recognition system. This was unusual. We got the first VAX system. In fact, Digital Equipment Corporation helped us out, and they gave us this big VAX system to build this. It's very expensive, by the way. But anyway, this represented the first computer configuration that was going to tackle and do something for us that we would no longer need humans to do for us. This is a digitized picture of a rat. It's the top view and a side view of a single rat that's in the environment. But what this represents socially is the first time of a computer seeing a rat so that, again, humans wouldn't have to watch this videotape. Now, I'm not going to go into all the science behind this because we have a long story to tell, but I just want to point out that what we were measuring were the initiations of a whole list of movements of the rat. We were measuring the total time. And the third most important parameter is down here at the bottom. The third thing that really made this system work and made it sensitive and made it do something that no one else had done is we could quantify how behaviors were put together in a sequence. If you do, in certain behaviors, in speech, in reproductive behavior, and even in your spontaneous behavior, everything is structured in a certain sequence, or things do not get, finished. Mating behavior can't go properly, the speech doesn't make any sense, and what we found is that the sequential order of behavior was the key, the sensitive element to finding low-level effects or low-level changes that a substance is going to have on the central nervous system. So down here, even though the total time and initiations of each one of these acts that the computer had been trained to identify, the sequences, and you will see K values on here, don't get upset by that, but it's physics talk or functions of how you would mathematically measure and compare two different sequences or how animals put their behavior together. So going on in methodological development from 1985 to 1992, we had to do a lot of development to put any kind of methodology out on the market. I mean, we published this is the god-awful formula for quantifying the behavioral time structure. We had to develop the statistics that had to go with that. We got into Monte Carlo methods and bootstrapping. These are computer-intensive methodologies that you're not going to see. They're a long ways away from parametric and non-parametric statistics. We had to do controls versus experimental. We had to show the criteria for significance. We had to do false positives, false negatives. We had to show a dose response. And we had to develop what they call the RS statistic. What that RS statistic, all that is it means we do over 100 and some measures on these animals for 15 minutes when they're in this environment. And in those 100 and some, you can't measure just a few. You have multiple comparisons. So we had to go through the whole statistical procedures to show that this is a valid thing to do. When you find just 1 or 2 or 3 or however many, you had to know whether that's chance occurring or whether it's a real live effect. So we went through that development from 1985 to 1992. Now, with this development, what happened along the way? Became a hero to some. Got a letter from the PETA, people in PETA. They thought this was great because it's spontaneous testing of animals. We didn't shock animals, we didn't starve them, we didn't do any of those techniques anymore. So the animal rights people thought we were great. All of a sudden, all we would allow the animals to do is put them in the environment. They could do anything they wanted to do. We had conferences, and this is a picture of Jack Hine at one of the conferences that we had. We invited industries in. We invited the National Institute of Dental Research in. Everybody was very proud that this technology had been developed at Forsyth, which was our department was the first toxicology department in the world in a dental research institution, I was told at that time. And so I was on a fast track right quick. This is Gert Quigley. I mentioned this. She was the assistant to Jack Hine. And I was very much in favor and at the institution, and they all came to the conferences, and industries came because industries provided the funding for this development every step of the way. Not $1 came from NIH. I applied it to a lot of things at the time. This is Harold Hodge, also at our conferences. People were looking at our data, they were looking at the technology, and everything was great. In fact, we ended up in the Wall Street Journal. Don't you kind of judge that as your edge of success when you finally hit the Wall Street Journal? I can't, this is a little too dark for you to read, but I can tell you basically what it was saying is that researchers at Forsyth Dental, have shown with the camera system, and now we can do something that we've never been able to do before. Not only did we hit the Wall Street Journal, but we hit we hit the Boston Herald. And it said medicine and education, computer speeds up poison tests. All right. Then I was invited to come to the ADA sponsored or set up a biocompatibility workshop in the late 1980s. And there's a picture of myself with Chakwan Su, who is the toxicologist from the ADA. So I was on my way. Everything was going very well. I was even the Forsyth toxicologist on the NIH panel that was to write the little brochure about mercury poisoning. And that's another story that I can't go into right here, but...
Back up and go forward again.
So then what happened? Then the honeymoon was over. And then things got really interesting, and things started taking a little kinky turn. In other words, Mr. Toad's wild ride is starting to we start out a little slow, but now we're going to go a little faster because things started getting a little kinky. In 1990, I had been doing the first preliminary studies. We built the methodology, and at the time, I got a grant from the National Cancer Institute. The National Cancer Institute gave me this grant to look at the neurotoxicity of the treatments of the neurotoxicity in a rat model of the treatments for acute lymphocytic leukemia in children. It was a very, difficult animal model to predict, but we were doing something, again, because we had the computer system that no one else could do. And at the same time I was doing that publicly, privately, I had told Jack Hine and Harold Hodge that, yes, I will apply it to the first dental product, which happened to be fluoride. And I started collecting preliminary data. And publicly, I was being, praised for my work on leukemia because we were predicting something that had matched very well with what was being found clinically. As a matter of fact, our animal model was written up in the Yearbook of Oncology, and Dr. Simone, who was one of the founders of the treatment of leukemia, said something to the effect, finally, we have an animal model to look and predict a neurotoxicity in animals before we actually use the treatment in humans. I mean, that's the purpose of doing animal models, right? Well, then I was doing fluoride very quietly. I had no money, of course, or any support from any institution, not even my own, to do the work on fluoride, but I had said if I came to Forsyth that would be one of the first things we would look at. Dr. Hine matched me up with Dr. Pamela Dinbeston, who is currently at the University of California at the San Francisco department. Dr. Dinbeston had developed, worked on a rat model to look at dental fluorosis and study the whole process. And so Dr. Hine said, well, just use some of her rats. The only problem with those rats is that they have dental fluorosis. But it shouldn't, it's just good for your teeth, and it's just dental fluorosis. After all, that's just a cosmetic problem. So there shouldn't be any other problem with these animals. So I said, fine, then, I could always use another control. I mean, here we had new methodology. We wanted to look at as many animals as we could get a hold of. So I put it into the system, and the data started coming out, and things weren't matching up. Things started looking very curious and very strange. I went to Jack Hine. I said, this stuff doesn't look clean. It may be good for your teeth, but something else is going on. Dr. Hine said, well, that's curious, and so he listened. And then he got excited enough about it, and he shipped me off to the National Institute of Dental Research in Washington. And then he said, I want you to tell them what you just told me about your data. I said, be glad to give a little talk. Jack flew down to Washington with me, went to the National Institutes of Dental Research. I had a little bit of time before I walked into that meeting and gave the presentation. So being my first visit down there, I decided, and especially my first visit to the National Institute of Dental Research, I decided to walk over to the main hospital at NIH. And what do I see when I walk in the main corridor of the hospital? But it had plastered all over the wall the miracle of fluoride. And I'm coming there to tell them that their miracle is probably lowering the IQ of children. I read about how they made fun of anti-fluoridationists. I read about the little old lady in tennis shoes and all of these little stories because they had newspaper articles going back to the 1940s. So, needless to say, I was a little nervous when I was to go in and give this presentation. But I did. I walked in and I gave the presentation. There were not just dentists there. There were people from the Food and Drug Administration. There were people from the Public Health Service in uniforms. And I didn't know any of these people, but I gave my spiel. I got a letter, or Dr. Hine got a letter after I came back, and this letter is what you see here. Actually, I don't expect you to read that. I'm going to read it to you. This is what Harold Lowe, I don't know if you remember him, but he was the director of the National Institute of Dental Research before Harold Slofkin took over recently. He wrote a letter to Jack, and he says, "Dear Jack, I appreciate your recent visit here to discuss Dr. Phyllis Mullinex's preliminary findings based on the behavioral activity methodology she has been refining and validating." I thought I'd gone through that already, but he decides I'm refining and validating it. "Since your visit, the reprints and galley proofs Dr. Mullinex supplied have been circulated to appropriate extramural and intramural staff. We have had some additional time to reflect on the methodological questions raised at the meeting and to examine the options available to the NIDR. We all fully acknowledge the innovativeness of Dr. Mullinex's approach, her productivity, obvious enthusiasm, and the potential significance of work in this area. My personal feeling is that a regular research grant supporting further development and validation of this methodology, as well as the assessment of specific substances, might be of greatest long-term benefit. NIDR would be pleased to support development of such an innovative methodology, which could have broad significance for protecting health." And it goes on because from there, you know, he started making suggestions of how I was to get this support. Make a long story short, 2 years later, I had gone and tried every mechanism that they supposedly had. Finally, one of the underlings under Dr. Lowe said, "Well, there's no way to get money this way. You're going to have to write an R01 and go through the regular grant process." Now, and so I did, but I will pick this story up in a minute. Let's go on. What did I tell them while I was there? I showed them just a couple things, 2 graphs. I said, look, the one on the top, this graph is what I get from the ALL treatment. In the clinics at the hospital, everybody knows that the treatments for ALL ends up with special education for the children, IQ deficits, memory problems, the whole thing. I said, you know, that's what happens, this K-value. In other words, the sequence of the behaviors, how they put these things together, is very disturbed. It starts getting a clustering. ALL is acute lymphocytic leukemia. It's childhood leukemia. And again, the neurotoxicity that's associated with this treatment is the one hang-up that they use, you know, that concerns them. They save the child, but then the child has to go through special education, IQ deficits, and the whole problem. And so the emphasis was, as an animal model, to try and learn how to manipulate that therapy, reduce the toxicity, but keep the efficacy the same. So I had gone through years of study, you know, working on this. I knew very well what was going on with that well-known and well-established clinical treatment. And then I compare it with fluoride, and I said, admittedly, the effect wasn't exactly the same, but it was going in the same direction. And gee, it's 100 parts per million of fluoride, and that's only supposed to have dental fluorosis. So I said, you know, that looks a little strange. In addition to that, I also pointed out, I said, you've heard of amphetamine, haven't you? I mean, if you don't know what ALL is, I know a lot of you know what speed is. I said, 100 parts per million of fluoride in this particular behavior, looky here, it's at the top. It's even more than 2 milligrams per kilogram of amphetamine, 1 milligram per kilogram of amphetamine, 0.5, and then 75 parts per million of fluoride was down here. But still, the changes were going in the same direction. Said, this doesn't look good, guys. As a matter of comparison, when I start looking at these things, why shouldn't I be suspicious of fluoride? Don't you think you ought to take a look at it? So then they looked at me, and also notice in that letter, this is what made me suspicious back in 1990. NIDR and Harold Lowe wrote that letter to me, but there wasn't one mention of fluoride. He talked about my methodology, how innovative it was. I went down to Washington, I presented all this data and those types of comparisons, but not even the word was mentioned in that letter, fluoride. They wanted me to divert my attention from fluoride. They wanted me to study anything else, even mercury, but they didn't want me to study fluoride. So I went back and I didn't say too much, but I said, well, gee, I guess I better do some more studies. But there was no support coming from the institution. No grants, totally shot down. I started looking in the literature, and when I published that paper, I had found a few links. Now, you'll notice most of these are in the Chinese literature. It wasn't a very impressive link to the brain, and so, but I put it into the introduction, and at that time I didn't know that there was really much at all, but there was some indication that there was a direct effect of fluoride on the central nervous system that has nothing to do with skeletal fluorosis or a bone pinching of nerves or whatever, that was causing the neurological problem. So this is all I had to start with. But then I went in and I started reading papers by Gary Whitford and looking at the doses, and I looked at Taylor, I looked at all the animals, I looked at all the effects on the kidneys and so forth and so on. I was trying to get a feel as to what levels I should be looking at. In addition to that, I realized after looking at all the literature that the variables influencing the sodium fluoride effects and the LD50, or the lethal dose that 50% of the animals will die, it varied all over the map with respect to species, strain, age, and sex. The other problem was, at the beginning, the methods for detecting fluoride really weren't that good. On top of that, I read in the in vitro information the anti-metabolite properties of fluoride. Inhibits cell proliferation, delays cell differentiation, increases concentrations of cyclic AMP via interactions, and all of this. And I asked some of my dental friends, I said, what does this mean to you? Oh, it goes in and affects the teeth some way or another. And I looked at this from the viewpoint of a neurotoxicologist, and I started getting concerned. I started then designing as coming from the viewpoint that this stuff, if it has these properties, then we better design studies completely with brain development in mind. I started thinking, how on earth could fluoride affect the central nervous system? I have to have some kind of a clue or an idea as to what could be happening. And then I started finding a little more in vitro information to go along with it. I found some studies that said the exposure occurred during granule cell formation in the hippocampus and the cerebellum. I got studies that would show that. I found studies that interruption of hippocampal development leads to hyperactivity and or learning disabilities. I knew that the hippocampus, how that was involved with memory and learning and that kind of thing. Didn't have anything to do with fluoride, but I knew what the hippocampus would be in problem. Then I saw that fluoride is the most regionally distributed element in the normal rat brain. Hippocampus and hypothalamus have the lowest concentrations. That tells me, aha, the brain doesn't like fluoride in certain areas. That is unlike some of the other elements, like potassium and other elements. Fluoride was very regionally distributed throughout the brain. So my immediate question was, well, what happens if you screw up that regional distribution? What happens then? Then I found that intracellular fluoride alters kinetic properties of calcium currents in hippocampal neurons. There was that in the literature. And I knew there was a long history of halogenated materials having a special affinity for the cerebellum, and cerebellar signs are common in their neurotoxicity. So then I started designing my own study, and I said I'm going to do prenatal and I'm going to do postnatal studies. I did it entirely by first knowing the development of the brain. I'd had a long history of using X-ray to block certain areas of the brain, the development at certain times. We have a very strict, not strict, but we have a timetable. We know what cells are developing in the brain, in the rat brain and in humans. But in the rat brain, we know which ones are developing at what time. So I started designing exposures, anticipating the types of problems that I would see in outcome later on. So I will talk from here on out about prenatal data and postnatal data. And then we published the paper, Neurotoxicity of Sodium Fluoride in Rats. Myself, Pam Beston again, and in this, you probably might note that we did not show any acknowledgement of any support. I did acknowledge Harold Hodge and Jack Hine for their encouragement to do this type of study. So with this publication, basically, here, I'm going to go through this kind of quickly because there's some the story that Mr. Toad's Wild Ride gets even wilder. In this, this is a prenatal exposure. I played around with what days. I did days 14, 18 in the rat versus 17, 19. I knew how to inject it. We gave two sub-Q injections, and we weren't getting the problem. But we then looked at Whitford's work and learned about the metabolism, and we ended up doing 3 injections per day every 4 hours between the days of, say, 17 and 19. And lo and behold, that's when we started getting the effect, the sex effect at 0.144. That's the RS statistic. And I said, aha, I finally know how to manipulate the dose. I know how to manipulate the exposure to get the problem. Now, this was unique. Nobody else has done a prenatal exposure and gotten this kind of thing. And what is the problem that we're seeing, the outcome? We see those K functions, meaning the structure of that behavior, is going down. What does that mean? It means we are totally disrupting the sequence of behaviors. With those few injections on those few days prenatally, that's all the exposure that these animals had. When those animals grew up, they couldn't put one foot in front of the other, right, if you will. And what they were doing is scrambling their behaviors. We see that type of thing in drugs that cause attention deficit disorder and hyperactivity. So this was a concern because, again, that's just one acute peak exposure prenatally. So that was a relatively simple to do, but we need to do more studies. Not that I'll ever get money to do more studies to confirm this, but nevertheless, we did enough rats, and we certainly had statistical significance in that, and they cannot deny that this is happening. You can't excuse this away as something funny in the drinking water. You cannot excuse it away. There are no fluoride levels in these mothers or in these animals when they grow up. There's no fluoride in their blood system. It's a one-shot interruption of brain development, and a lot of things will do that. Now going on, then I switched to the postnatal. The postnatal is a little more involved. You have to worry about the animals drinking the water. You have to the amount getting into the system. You have to worry about whether it's affecting their body weight. And the only reason I'm showing you this is that anytime we got a level of fluoride higher than 125 or at 125 parts per million in a rat, those all the body weight all the way across in these are females, all the body weight is going to start going down. Well, I'm not interested in causing the animals to start losing body weight. I want to look at very subtle effects. I want to go towards animals, they're getting 100 parts per million, but has no significant reduction in body weight. So with these studies, I want to go 100 parts per million and lower. This was for only 6 weeks of an exposure starting when the animals are weanlings. I don't know what happens if you go lower and lower levels of fluoride, but for longer and longer periods of time. And to my horror, I found out that nobody else knows that either. This is the effect of males. It's just to show that we've got the same thing. We have to start with levels of 75 or 100 parts per million and go lower. Again, this wasn't supported. We did this all, on our own. We did not have any financial help, so we only did it on animals as we could get them. This shows the plasma levels, and I'm not going to go all through that, but at the various 7,500 or 125 parts per million in the drinking water. But all this is to show we knew what those plasma levels of fluoride were, and we know that in a rat, if you give 100 parts per million in their drinking water, you end up with a level of fluoride in the plasma that's going to be equivalent to a human drinking about 5 to 10 parts per million in water or beverages or whatever. So the blood level, the plasma level in our rats are definitely plasma levels that we see in humans today in these exposures. So the age-old argument that I get from a lot of the dental communities or from the dentist, oh, these are large levels. If you go into the literature, these are low levels compared for a rat study, because you're ending up with plasma levels that are right in the range that humans are going to see. Now, again, this is the females. Again, this is the effect on behavior. Again, the RS statistic. And we definitely got a horrendous effect here at 0.359 at 100 parts per million. It goes lower at 125 parts per million. We thought, oh, could this be some kind of a fluke in the data that it went down as the parts per million in the drinking water goes up? The behavioral effects seem to be lower. But what we learned was that actually the plasma level at 125 parts per million in the drinking water was lower than that at the 100 parts per million. The reason for that was rats won't drink it. They don't like it. So you can't get a plasma level of fluoride, you know, if the animals aren't drinking it. When we then plotted the behavioral effect versus the plasma level, then it makes sense. And the behavior, what you're seeing here is the behavior going more and more abnormal as the plasma level is getting higher. So what you have to distinguish, first ask plasma levels. Don't talk about exposure level in the drinking water. Go directly to the plasma level. Again, this is just in the male behaviors, and I keep pointing out males and females because I noticed a very distinct sex difference. What was happening is that the females are usually affected at lower doses. There's no question about it. Is that unusual in neurotoxicity? Not at all. We see it every day in clinical situations. If you look at some of the other toxicologists and if you listen to the critiques from some of the dentists, they say, oh, if you're not getting it in the sexes, the same effect in both sexes, then that must mean there's something spurious about your data. I guess dentists haven't learned that there are sex differences. Now, the point of the matter is, here's the behavioral effect. We haven't done all the male behavior. We've done more female behavior than we have male. But keep that in mind. There are differences in sex because this is going to come up later on. Then in all the behavior, I won't take you through these numbers, but when I said we did the 100 and some measures, my first question was, is there any kind of consistent pattern to what we're seeing? The answer was absolutely. From even across the sexes, once the sex was affected, once the males and the females were at a level that they were affected, the effect that I saw on behavior was the same across the sexes. The same behaviors, the same type of change in total time, initiations, or the time structure was the same across all of these particular parameters. What happens? To equate it in language that you would understand now, I would call them couch potatoes. Because they don't sit, they don't look, I mean, they just kind of stand there and do nothing. Basically, if you go across in all of these, it's just the same thing continued. This is across males and females, both at the same 125 parts per million fluoride level. For the same 16 weeks these animals were, it went across the sexes. And then what I also noticed, if you take one sex, females, and if you go across two different doses, is it consistent? Yes, it is. So the effect went across doses, it went across sexes. All right? And then we did another exposure at the adult age. And we found as the adults got, as the females got older, they got even more sensitive. So what you do, you know, at various times in the life, the age is a very big parameter. Now we're going to go into one other thing in this study, and then this is the last of the scientific side, and then we're going to go into some pretty wild stuff. But what we also found that nobody else knew is that fluoride accumulates in the brain. Gary Whitford says that fluoride does not get across the blood-brain barrier. I don't think Gary Whitford has actually done the studies to prove that one way or the other. What he did was gave an acute ejection and then measured 1 hour later and said that there wasn't much in the brain. So he had poo-pooed that. But anybody in toxicity studies know that you don't look at a chronic exposure and call that any kind of an indication, one acute injection, an IV injection, and then measure it an hour later in the brain and say that that's a measure of how much actually gets across the blood-brain barrier. It doesn't work that way. So we showed evidence of how it was accumulating in various areas in the hippocampus. This is in both sexes at 2 different doses. So I won't go into that. Now, the conclusions then for that study was that CNS function is vulnerable to acute and chronic exposure to fluoride. Effects on behavior depend on the age and exposure, and fluoride accumulates in brain tissues. Now, what happens when I publish this stuff, and what was the conclusion? I can tell you what happened immediately. NIDR did not fund this, but yet, when I went down and announced to the front office that this study had just been accepted, had gone through peer review, and is going to be published, Gert Quigley said, "We have to tell the NIDR." I said, "Why?" I said, "You can tell them whatever you want. It's going to be published." So they called up. Dr. Pat Bryant, who's head of extramural research, called up, and then she started calling me. And she said, "I want to hear more about this. Will you please fly down to Washington and tell us what you're going to say to the public before you present it?" I said, "No, I can't do that. Forsyth has just asked me to leave the institution, and so I don't have the money and I don't have the time. I have to move my laboratory out very soon." I said, "If you want to know what I'm going to say, why don't you and your friends at NIDR fly up to Boston?" She said, "No, there's too many of us. We cannot come up to Boston to do that." I said, "Well, we got a problem. I'm not coming down and you're not coming up." So then she says, "Well, we'll do a television conference." I said, "Fine, you pay for it." So they set up a television conference. It was held over at Harvard. It lasted about 3 hours. We were hooked up. They didn't know that we could hear them. We couldn't see them, but we could hear them. They couldn't hear us. And I had several people on my end, who had been involved in the study, and we heard Dr. Bryant say, "We don't want this to be an inquisition. We're just trying to find out what she's going to say to the public before she says it to the public. So please be nice." It wasn't. So that was in 1994, the beginning of June, and I had to move out at the end of July. I was supposed to get out at the end of June, but the lawyers haggled and I could stay until the end of July. Magnanimous, don't you think? So the next part of this story is, yes, but it's good for your teeth. I've heard that. I said, it affects your brain, and they didn't want to hear it. They said, it's good for your teeth. It's good for your teeth. So now we're going to go into the next part of this story. And I know you can't read this, but I put this up for one reason only. In 1990, Harold Hodge died. I knew he was a part of the Manhattan Project, but I didn't know what that meant. I didn't know what connection he had with fluoride. And after he died, a knock came at my door this was in 1996, the summer of 1996, and it was some investigative reporters knocking on my door saying, "Dr. Mullinex, what was your relationship to Harold Hodge?" I said, "Harold was in his 80s, it wasn't much of a relationship." But they said, "Well, you worked with him. He was in your department." I said, "Yes." And they said, okay. They started showing documents to me. They started pulling them out. And they said, "You published this paper on the neurotoxicity of fluoride. do you know about what Harold Hodge had done in the Manhattan Project? I said, no, I had no idea. And I said, you know, Harold, when he died, Jack Hine did give me several of his volumes of books entitled The Pharmacology and Toxicology of Uranium Compounds. So I went and I pulled those out and decided to look at them because I didn't know there was a connection between uranium and fluoride. I had no idea at that time that fluoride is absolutely essential to the process of purification of uranium. And in fact, there was an entire series of literature and information and studies that had been done on people. A lot of them didn't know that they were being exposed to fluoride. It was just an experiment to say it was good for your teeth. But really, it was a military experiment to look at the chronic long-term effects of fluoride. So I started going through these books that I had, and I realized here, you can't see it at the very top. I don't know if you can pull that down. Can you pull it down? Well, it's the organizational chart of the Atomic Energy Commission. And in fact, if you, there you go, organization chart of the University of Rochester. And I noticed right here was the Pharmacology and Toxicology by Harold Hodge. He was the director of that. And he was directly put into the U.S. Atomic Energy Commission. Now, the U.S. Atomic Energy Commission was the precursor of the Department of Energy today. So that was an eye-opener, and I didn't realize that these other divisions were all military people. Okay, so things started clicking. Then things got a little trickier and went further. They started pulling out documents, and I started reading. One of the things, one of the books that they also showed to me, one of the volumes had been missing in my set. Harold Hodge wrote a description in 1949 about some accidents of people that were exposed to uranium hexafluoride. And in this, they described the accidents. Here's the first accident as to what exposure to these workers that were making the bomb, what happened to them. Quote, all the seriously injured individuals were unusually nervous. I wouldn't blame them if I was working on the making of the bomb. But they were unusually nervous and apprehensive for 4 to 5 days after the accident. One individual was definitely overstimulated for about 3 days, exaggerating all facial expressions and being unusually verbose and talkative. At times, he was almost incoherent. The other seriously injured patient, although normally quiet and placid, became very apprehensive with a similar tendency toward the exaggeration of statements. The opinion of all observers held that the mental reactions were more than could possibly be explained on a fear reaction basis. Then there came a second accident. Remember, uranium hexafluoride is a gas. And when they were doing studies on it, they had to look at all forms of fluoride. They looked at uranium hexafluoride, the uranium tetra. There were a whole series of fluoride compounds that they had to look at. But they had these in gas canisters. The second accident, quote, this is what the worker was described as. The mental status for the first 5 or 6 days following the accident was marked by general sluggishness with transient periods of restlessness, irascibility, and nervous tension with occasional silliness and loss of contact. Okay, so that's what these workers were going through. And then the investigative reporters pulled out this document. And this is when I went ballistic, when I realized that I had been working with men. It wasn't just Harold Hodge, it was also Ben Ander. He was a part of the Atomic Energy Commission and actually done the inhalation studies with uranium hexafluoride, and never told me. I worked for these guys for 7 years, and no one told me anything at all about their toxicity testing on people and any of the animal experiments during the Manhattan Project. Of course, these documents were classified, but then it went through a declassification process and no one told me. They were declassified by the time I was working with them, so there was no reason not to tell me. Maybe they didn't know that because the government doesn't exactly announce when they declassifies these documents. But here's one note that really upset me at the time. One document, it's dated 1944. It was a request for animal experimentation to determine central nervous system effects. It was sent to Colonel Stafford L. Warren of the U.S. Engineer Office, Oak Ridge, Tennessee. Keep that Oak Ridge, Tennessee in your mind. Later on, it becomes important too. And he states in this statement, clinical evidence suggests that C616, that was a code word when you read these documents. C616 stands for uranium hexafluoride. Anyway, may have a rather marked central nervous system effect with mental confusion, drowsiness, and lassitude as the conspicuous features. It seems most likely that the fluoride component, rather than the T is also stands for uranium, is the causative factor. Then they go on to say, since work with these compounds is essential, it will be necessary to know in advance what mental effects may occur after exposure. If workmen are to be properly protected, this is important not only to protect a given individual, but also to prevent a confused workman from injuring others by improperly performing his duties. So I found out that Harold Hodge then, 50 years ago, had proposed to do the animal study that they brought me into Forsyth to do 50 years later. They proposed it in 1944. Next document, also a little bit later after 1944. Again, request for animal experimentation to determine central nervous system effects to the area engineer in Rochester, New York. This office approves the experimental program on the possible effects of T-salts on the central nervous system proposed by Dr. Hodge and concurred in by Captain Ferry and Major Hadlock. And they set up a budget. And this goes on in the document to prove it. But then what happens? Another secret document, not even 6 months later. And it states, it's September of 1944, after some conferences, it goes to Colonel Warren. It says, direct order not to start or to discontinue, if it has been started, the program of Dr. Adler as outlined by Dr. Adler and approved by Colonel Warren, quote, behavioral and mental concomitants of tea poisoning in the rat. So it was killed. They knew it had an effect, and they didn't want to deal with it. I don't know why, so you don't see any of the information that I just gone through. And I was told in my grant reviews and all of this, there was no link of fluoride to the central nervous system. No wonder there's no link. It was stopped by the military a long time ago. Nobody was allowed to go in and look at it. Well, I thought I'd seen it all because I would have been upset. I'd been working with this, and then I started reading other. I then found out about, it was in the newspaper in 1945, they had an article. There was a lawsuit back then because DuPont was processing the uranium that they used in the atomic bomb. They had a big leak of the fluoride all over from the uranium hexafluoride processing. How bad was it? It was bad enough that people were vomiting in the field because the fluoride went into the air. Because again, the forms that you have are hydrogen fluoride. It could be, and when the fluoride hits the water, you can form hydrofluoric acid, et cetera, et cetera. Well, anyway, it polluted the fruit. It destroyed the peach crop. Peaches that were sent to the Waldorf Astoria. So the farmers were very upset about this. And in these documents, even the Department of Agriculture said, we're going to have to embargo this fruit because when people eat it, they get sick. In fact, there had been a party out in the field that was described in these documents. In the party, they were all eating watermelon. And the people got very sick. They started vomiting. They started having diarrhea. And they ended up in hospitals. People were poisoned. Blood levels were drawn in some of these. And I looked at the blood levels. I've never seen levels of fluoride so high in the blood in all my life in these. So they knew how bad it was, so the farmers sued. The farmers sued, and they wanted to, get help because their crops were destroyed. But then what happened was that They couldn't, because then the government said, we're about to drop the atomic bomb. Would you please put your lawsuit off until this becomes public? And the farmers did. We were very patriotic in those days. So they said, okay, we'll wait to sue. And then after the bomb was dropped, they thought they could go forward with the lawsuit and everything would be fine. But then there was another problem. What the government did, so in the lawsuit, the people couldn't find out how much fluoride they were exposed to. So their lawsuit fell through, basically. They did get some money for repairing the crops, but that was basically it, because all of this information was stamped classified and secret. So they wouldn't allow this information to go out. So then, knowing this, what does the government do in these documents? But they go through all these procedures to start preparing to, what I think the expression is, cover their ass in terms of the lawsuit. They started collecting data, how to get them out of this bind in this lawsuit. They knew that people were sick. They knew that people were poisoned. It says in these documents that they knew that the fluoride level was so high in the air that it was etching the glass of a schoolhouse next to the DuPont plant, and the glass had to be replaced all the time because fluoride is very good for etching glass. Ask any glass worker out there that knows. So in all of this, what does Harold Hodge come in and say to the government when they're trying to cover it? What does he say? As I said, they went out trip, they took a trip out to the plant, they knew the people were sick, they knew people were in the hospital, and he states in this letter that there's no reason to doubt that it was hydrogen fluoride. He said at the school building at Deepwater on the west side, many windows show etching. And then this one really killed me. He said, would there be any use in making attempts to counteract the local fear of fluoride on the part of residents of Salem and Gloucester counties through lectures on fluoride toxicology and perhaps the usefulness of fluoride in tooth health? Signed, Harold C. Hodge, Chief Pharmacologist. Isn't that wonderful? Make everybody less afraid. Tell them it's good for their teeth. And it gets worse. Here's where we bring in the Journal of the American Dental Association. In 1948, this one, I thought I'd been over the edge before, but this one really did it. 1948, volume 37, number 2. They talk about the dental conditions in workers chronically exposed to dilute and anhydrous hydrofluoric acid. Macaulay, the author down there, DDS, Rochester, New York, they were involved in the Manhattan Project. These dental conditions in workers, these were uranium hexafluoride workers. If you go back in the literature, I'm sure you can get it back to 1948, read the work environment that these people were in. And read it, because here's what they were doing. They were working in an environment where the fluoride level was so high, and it says it in the paper. It was so high that no cats or dogs would walk in the environment. The fluoride was so high that no microorganisms could live in the environment. When they took their lunch into this environment, the fruit wouldn't rot. Why wouldn't it rot? It would dehydrate first, because no microorganisms would live. And then they would describe in these that these workers seemed healthy. They didn't get any colds or viruses or flus. How do you get a cold or a virus or a flu if no microorganisms are going to live in the environment? Besides that, the fluoride was so high that the fluoride causes their shoes to deteriorate. Their shoe leather. They would work on the nails, so they had to wear rubber boots. And besides wearing rubber boots and all of that, the skin lesions that you got from the fluoride was so bad that in the environment that they couldn't even employ fair-skinned individuals. Now, let's go on. What does the paper say, the Journal of the American Dental Association? You can't hardly see it here because a lot of these documents are very old, but I will have to say, avoiding all of those problems in this environment, what do they talk about? Well, it's good for your teeth. It looks like their cavities are decreasing. But what they don't tell you, and what we have now, we have the secret document that goes along with this work. And even though they show numbers of total teeth involved in total fillings and so forth and so on going down, what they actually show is that these workers were losing their teeth. We have the secret document, and this is the title of it, that went along, and it was there in 1943 in Cleveland, Ohio. A study of dental conditions in workers exposed to dilute anhydrous and fluoride. Anyway, it's the same data. And there we learn a lot more. We learn that in these that is supposedly good for your teeth, this is what it says. Active carious lesions were not observed in subjects exposed to the acid in production. This finding was in spite of the fact that as a group, these men neglected their mouths, employed little or no oral hygiene, and were in large proportion edentulous or nearly edentulous. Now I ask you, if you're doing a quantification where the numbers of teeth involving fillings and all these surfaces are going down, how do you do that when the workers are edentulous or nearly edentulous? I don't know how that works. Maybe you can tell me. But in addition to that, they go on to say that they wondered if the fluoride was in fact causing their teeth to fall out. They also talk about a brown scum developing on these teeth, and that if they brush their teeth, it wouldn't be such a problem. But many of them did have the brown stain. So where were they getting these polished teeth? Where are we getting this good thing that it's good for your teeth? Stupid, who cares when your teeth are pretty? I had to relate then the information that we had in our findings quickly to the literature. And I'm going to go through this next series very quickly because I want to get into the final, how this is relevant today. But I can tell you, I'm not the first. Now that I know where to look, there are a lot of papers out there that are linking this stuff to the central nervous system. And there was a paper by George Walbot back in 1956. And I'm going to go kind of quickly here. And Walbot said in 56, he talked about these workers, cryolite workers, again, fluoride exposures, and 21% of all of them are going to show paresis in arms and legs, instability of gait, hearing disturbances, and so forth and so on. Again, they knew about it back in those times. We keep going here quickly. They showed tetaniform convulsions precipitated by fluoridated drinking water. We're up to 1957, and again by Walbot. I can also tell you in the state of Connecticut that we had a lot of children that were showing convulsions when a hydrogen fluoride plant turned out too much, but they couldn't shut the plant down because there was no link in the literature with fluoride linking to the central nervous system, so they couldn't stop the exposure. Thankfully, the spill was cleaned up, the emissions were decreased and the convulsions disappeared. But there is a definite link in the literature to convulsions. Also, the spinal cord, what they basically found was that there was direct action of fluoride on the cord tissue. It's a pre-skeletal fluorosis phase where the pathology has nothing to do with the skeletal fluorosis. And going on, and I'm missing a lot of these because there were studies all the way along, and when they described these workers, it was typically what they found were headaches, back pain, decreased intellectual power, memory loss, illegible handwriting, trouble spelling, and these guys, depression was very consistent. You have to look at your occupational exposures. And this guy, he got his fluoride exposure from, he was in the Army. By the way, in the Army, like in the Gulf War syndrome, nerve gas is a fluorine component to it. But anyway, maybe you didn't know that. Maybe you didn't know monofluorophosphate was very close structurally to nerve gas. But anyway, the toxicity, these guys, definitely showed the paresis. There's also been a link with mania. There's been a hypothesis proposed with that. And we're getting up to now, 1992, there was an article again in the Wall Street Journal linking rat studies, linked brain cell damage with aluminum and fluoride in water. That's Dr. Isaacson's work, also having troubles with getting funding, doing this kind of research. But what he found was, he found a pathology in the hippocampus that I had also predicted was being affected from our rat studies. Then there was an article called Psychopharmacology of Fluoride, a review, and there by Dr. Spittle in New Zealand, they linked it, said all of these symptoms, this depression, all of it is very similar to the chronic fatigue syndrome as of today. Now we're moving on up to 1995 and 1996, effect of fluoride exposure on intelligence in children. And 1996, effect of high fluoride water supply on children's intelligence. So, what we predicted from our animal studies, what had been confirmed in declassified documents, was in fact happening. We weren't fast enough or allowed to do these studies fast enough that we could have stopped this, but it's to a point now, and it's so widespread in the exposures that now epidemiological studies are starting to show the problem. The Manhattan Project is ancient history. There are no dead bodies today. There isn't a problem, right? These were acute, big exposures to fluoride, right? It's not happening today, but it is happening today. It is happening today as we speak because of occupational exposures to fluoride. At the same time, the dentists are pushing fluoridation of drinking water. You still have in this country a lot of occupational and unintended exposures to fluoride that has nothing to do with dentistry, has nothing to do with protecting teeth. It's unavoidable because fluoride is in coal, it's in glass, and a lot of these workers in the uranium hexafluoride workers down in Oak Ridge, Ohio, I can tell you there are several states across the country that have leaking canisters of uranium hexafluoride. On the Oak Ridge site, which is right now going on, and it's a very big problem, what they're doing is they're transporting a lot of this old World War II stuff across our highways down to Oak Ridge to be incinerated. And what happens is, so even though the war is over, even though these factories are not making this stuff anymore, you've got all these canisters left over. You've got these rockets, have all of these missiles, and they're out in sites, and the canisters are deteriorating and they're leaking. We say, so what, is that really doing anything? Tennessee is taking the nation's poisons. It's coming across the state lines and into Tennessee because they have the only licensed incinerator to burn a lot of this stuff. Well, you move on, they say incinerator, a perfect fit with past. It says the Cold War is over, but the cleanup keeps the legacy alive. So our problem now is not building the bomb. The problem is cleaning up after that process. That isn't over with. And worse than that, cleanup is as challenging as building the bomb. I'm talking about newspaper articles that they're not even a month old. Worse than that, they call themselves the exposed. And I brought this article because, and I have it here, if you'd like, I can't show it on here, but there are 32 people, uranium hexafluoride workers. They're described in these articles. I will go down. They tell their symptoms. First felt sick, fatigue, headache, dizziness, tremors. Does it sound familiar? Every 32 of these individuals, mostly female, again note the sex difference, versus male, but every one of them has depression, headaches, fatigue, da-da-da-da-da-da. And they can't figure out why, but yet they're working in a building which right next to it are 50,000 canisters of leaking uranium hexafluoride. Now, they walked around it, and they said, well, gee, since 1990, we had all these, we've walked around it, we've known that they're there, but they haven't been told as workers that this stuff is leaking or that it has a link to the central nervous system, because all this stuff is buried in secret documents. So, in that sense, you've got these uranium workers, and yet you're going in and fluoridating their water. So the number one rule of toxicology, which is stop the exposure, how do these uranium hexafluoride workers or people working in these environments get away from fluoride? It's in their drinking water. It's in their processed beverages. They can't get away from it. It's in their toothpaste, in their mouthwash, da-da-da-da-da. There's no way they can get away from it. And yet, you still have the dentists in the area pushing fluoridation of the water. And then finally, there are congressional hearings. People got sick enough. They're into the emergency rooms. They've got mercury levels, because also on this site, when an electrician goes up and cuts a hole in the wall to put an electrical outlet, elemental mercury leaks out of the wall. They have one of the biggest deposits of mercury that's unaccounted for, that they've swept under the carpet and underground, and it leaks out in these sites as they're doing all this. But anyway, in congressional hearings that took place in the state of Tennessee, where the state is fighting with the Department of Energy about this, is saying, our workers are being sick, you're going to have to do something about it. And they've admitted that they've got the uranium hexafluoride, they've got mercury, and they've got all these problems. So, now what do you have? You have Dr. Paul Conant, who writes Waste Not. Finally, the environmentalists are turning on to this problem, and they're saying there's a very big problem. So what are you going to have? You've awakened a big giant, where the environmentalists now are going to be fighting with the dentists, because, as I've been told many times, the dentists are the experts on fluoride. Now, so, if I were you, I would want to get out of this battle. I wouldn't want to fight with the environmentalists. I would think you would want to be responsible and help these people, because they're having all of these symptoms. Help them to defluoridate. Help them to get away from this exposure. Also, I couldn't pass this one up, because at the time that I was leaving, here's a letter from Gert Quigley. Remember the one who had her arm around me a long time ago at the conference? She says, she writes to the National Affairs Committee cohorts, and she is putting together the American Association for Dental Research, and she says, I have an amazing story to tell you, and it's true. When NIH Director Harold Varmus testified before the Senate Appropriations Subcommittee on Labor, Health and Human Services, Education, and Related Agencies, the chairman of the subcommittee asked him what, in his opinion, was the most cost-effective advance in health in the history of NIH. Dr. Varmus indicated that it was the reduction in caries through the fluoride research program of the National Institute of Dental Research that saves the American people billions of dollars a year. Then she goes on to say, do we have something to build on here or what? If anyone had any doubts about it and how impressive, blah, 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 but it goes on to say, hey, here's an advantage. We got to take advantage of this. We're getting more money for all of NIH because of our miracle of fluoride. I can tell you NIH isn't funding any of my research any further. There'll be no confirmations in the study, because they are not allowing any of these studies to go forward. And quickly, I just want to mention that because of these documents, I went to London and I met with several members of Parliament and so forth and so on. It came out in the newspapers, so our friends over in England have gotten really into this. And there was an article in the Sunday Telegraph, Colgate pays out for teeth ruined by fluoride. Over in England, they're taking these things very seriously, and the fight is going on very fast. There's Sir Ivan Lawrence, big fluoride fighter, presenting it to the media out front. This happened just this last November. And that's the House of Commons in the background. On the inside, there's Sir Ivan Lawrence again doing his speech, and there are several members of Parliament up front, and they're very seriously questioning. That's me giving a little presentation. Over there, the joke, the dental warning on fluoride after 1,000 pounds payout. But this joke says, a mother is saying to the kids, how many times do I have to tell you not to brush your teeth before you go to bed? You want to improve the dental health, but look what you're doing. You're driving people now to the point where they're recognizing the toxicity, and they're not even going to brush their teeth because they can't, of the fluoride warning. It's going over to the other extreme. This is the end. Little did I know back in 1982 when I sat with all of these members, department, there's Harold Hodge, there's Ben Ander, again with the Atomic Energy Commission, and Harold Hodge and the entire group, Max Goodson on the end. Little did I know what was going to happen just because I agreed to study fluoride. And then here is the end. Dr. Phyllis Mullinex, plaintiff versus Forsyth Dental Infirmary for Children, Forsyth Dental Center, Forsyth Research Institute, and Ronald J. Gibbons, Director, Defendants. Civil action in the United States Federal Court, the District of Massachusetts, and I can't talk about the lawsuit. It's happening next month. There it is. Sorry, it was a little long-winded, but I've been a little upset with this subject for some time. We're in the process of that. Let me just tell you that I've not been bashful. I feel like this information's been held from the public too long. It's time, and so I walked out of Clark University. Nobody knew we were going to hand out secret, declassified documents. But how do you get anybody to listen? Because they all say, it's good for your teeth. So what else are you going to do? No newspaper will listen to this. They go to the ADA, they go to these other sources. So how do you get this information out? Yeah, there'll be a book, but there'll be a lot more than a book, I can tell you that.
You can get the case over at Clark University from me.
The problem is, I've been to a lot of areas. I've been in New York. Long Island has thrown out fluoride in its drinking water, by the way. Of course, Worcester threw it out. I can tell you that referendums now are pending in Methuen, Massachusetts. We expect to win in that referendum coming up. There's a lot of things going on the scene. There's a battle in Florida going on, and it's unbelievable, some of the statements that have been made to me. It's unbelievable, the personal attack on me. I didn't give a darn about fluoride at the beginning. It was just another substance, another control group thrown in the system. So I've been very surprised at the response, but then again, I guess when you've got the Department of Energy, NIDR, Colgate, Procter & Gamble, by the way, in that newspaper article that came out in London about Colgate and its payout, who's mentioned in the article? So Colgate called me at home, I might say, just right after I got home and wanted their hands on these declassified documents. I told them to go to the library and look it up.
I've been accused before of saving the best to last, and I think we did that again here. We're going to have our forum now so that we're take about 30 seconds. If you want to just stand up at your place, don't go moving around, because we're going to move right into the forum and start taking questions for all of the speakers. So we'll have the speakers from all the last 2 days who are still here. I know a couple had to leave, take early planes back, but please come on up.
For those of you who can't read this is why we got secret declassified documents from the Energy Department. It says the government apologized to the last living victim of secret injection. Woman unknowingly took uranium in 1946. Rochester, New York. The last surviving victim of secret plutonium and uranium experiments carried out by government scientists 50 years ago got a personal apology today from Energy Secretary Hazel O'Leary. Mary Jean Connell, 74, retired factory worker, who was one of six unsuspecting patients injected with highly radioactive uranium at a Rochester hospital in 1946. In addition, 18 people were injected with plutonium, 11 of them in Rochester. All 18 have since died, as have the other uranium subjects. During a 45-minute meeting at the Hazel O'Leary apologized. How do you apologize for murdering 47 people? Anyway, apologized to one by one to Connell and the families of the plutonium subjects. Connell is the only one of the uranium patients whose identity has surfaced. We are not finished yet with our investigation and declassification of the information, some of which will likely be very important to other families, like those here today. As many as 48 people were injected without their knowledge with plutonium, uranium, polonium, radium, thorium, and radioactive lead in 1945 and 1946 by scientists working on the Army's Manhattan Project. The scientists, who eventually produced the world's first atomic bomb, wanted to gauge how radioactive substances may reacted in humans. The apology was part of the federal government's $4.8 million settlement last month. And Connell and relatives of 11 people who were injected with plutonium in Illinois, California, Tennessee, and New York. In addition, a lawsuit was filed yesterday by a niece of one of the plutonium experimental subjects who seeks $60 million in damage. Connolly vividly recalls her stay at the Rochester Memorial Strong Hospital in October of 1946 for an eating disorder that left her weighing only 81 pounds at the age of 24. She learned only last year that she had been injected with 584 micrograms of uranium-234 and 235, almost 5,000 times the maximum dose permitted in medical experiments today. The injections were done by scientists trying to learn how much radium would produce detectable kidney injury in humans. Ever since, Connell says she has suffered from persistent urinary tract infections, kidney pains, and hypertension. None of the uranium patients aged 24 to 61 was suffering from any life-threatening illness, and all were required to have normal kidneys and livers at the time of the experiments. The experiments exposed them to an increased risk of cancer, genetic damage, and suppression of the immune system, as Connell's attorney, Martin Friedman. Connell, who lives in Avon, a village south of Rochester, said she plans to buy a new mobile home with her $400,000 settlement, and she's not completely satisfied with the government's response. She said she fears that similar experiments could be undertaken again in secrecy. How do you apologize for murdering 40? Harold Hodge, Stafford Warren, nice guys.